Hello anatomy students. Here is another short-ish video focusing on muscles of the chest. These are muscles of the chest that should be on your hit list. Your professor may have included a few more. Again, each professor may modify the hit list as they wish. But for the most part, we have about, I would say, 90% overlap. You, again, should always check with your professor. The first muscle that I want to go over is the pectoralis major. And the pectoralis major, I'm going to outline it here in this purple color. That is the pectoralis major. On the picture on the slide to the right, I am also highlighting the pectoralis major. The pectoralis major has its origin on the clavicle, sternum, and costal cartilages. So we can definitely see how it is having its origin on the clavicle, circled here in blue, the sternum, circled here in blue, but also the costal cartilages, which would be underneath, deep to the muscle. So if you look at the picture on the right side is showing you deeper muscles, deeper structures. Both of these torso models are showing you the same presentation. Deeper muscles are on the right, and more superficial structures are on the left. And we can see the costal cartilages that are deep to the pectoralis major. Its insertion is on the greater tubercle of the humerus. Its action is to flex, adduct, and medially rotate the arm. One way I like to remember those actions are add to the fam, add to the fam. And that helps me remember that the A stands for adduction. We like to add to our family. We like to see our families get bigger. At least that's the optimistic person in me. So again, the pectoralis major, I've already gone over the origin, insertion, and action. These PowerPoint slides, you might want to use them to make flashcards. You may want to put the name of the muscle and a picture of the muscle on one side, and then on the other side, the origin, insertion, and action. What about the pectoralis minor? The pectoralis minor is deep to the pectoralis major. Again, our pictures of our torso show deep structures on the right side. And the pectoralis minor is shown here. I'm highlighting it in blue. Now, depending on the model that has been used, we want you to know that the pectoralis minor has origins on ribs 3, 4, and 5. 3, 4, and 5. True, this picture shows an origin on rib 2 as well. For testing purposes, we want you to know origin on ribs 3, 4, and 5. The insertion, you can see the insertion would be going up towards the arm. And over here on the picture on the right, you can see where the insertion is going towards the coracoid process of the scapula. Therefore, its action is going to be on the scapula, not the arm. It's going to be on the scapula. So it's going to draw the scapula anterior and inferior. That means it's going to allow for pulling your scapula forward. So it draws the scapula anterior and inferior. Again, here are the origins, insertions, and actions for the pectoralis minor. Our next muscle is the serratus anterior. Sometimes this is called the boxer's muscle. The serratus anterior is called that because it looks serrated like a knife, sort of with these scalloped edges that I'm highlighting here. So all of this is the serratus anterior. Its job is to protract. That means pull the scapula anteriorly and rotate the scapula superiorly and laterally, which is why we call this the boxer's muscles. We think of throwing a punch, an uppercut. You got to protract your scapula and also move them, rotate them up superiorly and laterally. In lecture, when you review chapter 9, the joints chapter, and also chapter 10, the muscle chapter, your instructor should be discussing these terms of movement: protracts, rotates superiorly, laterally. So protract, again, means to pull the scapula forward anteriorly. The picture on the right is showing you another model, and we can again see the serrated edges of the serratus anterior, and I'm highlighting this muscle. Its origin is on ribs 1 through 8. It inserts on the medial border of the scapula, and that is why its actions are on the scapula. Please remember that muscles will pull the insertion towards the origin. Always insertion toward the origin. That's how muscles pull. So if our origin is on the ribs and the insertion is over here on the medial border of the scapula, and we could probably see that better here. So origin, O for origin, I for insertion, we can see that the action would be pulling the scapula, protracting it, and can also help with rotating the scapula because, again, some of these insertions, some of these origins are from ribs that are higher up, ribs 1, 2, and 3, for example. All right, so again, here are the origins, insertions, and actions for the serratus anterior. Here is another picture of the serratus anterior, and I'm highlighting the scalloped edges where it's coming off of ribs 1 through 8, and we can follow these slips of muscle back to where the medial border of the scapula would be. Now let's move on to the external intercostals. The external intercostals are small muscles that are found in between your ribs. That's why they're called intercostals. So here is one external intercostal, and here's another one. We see little tiny windows of them. And notice the origin or the orientation of the fascicles. They look like they're sloping downward. And in my class, I like to say hands to pockets, pretending you're putting your hands in your pockets. The external intercostals actually have an origin on a superior rib. So let me write that up here. This line would be the superior rib. And it inserts on an inferior rib. And because the insertions are always pulled towards origins, this muscle has the actions of elevating your ribs. They are going to help with breathing in, inspiration, inhaling. In fact, they are going to work along with the diaphragm, as we will see in another muscle video. So again, external intercostals, they elevate ribs for inspiration, inhalation. And again, here on this model, let me just outline. 1, 2, here's another one. The external intercostals, notice that they reach as far medially as the costal cartilages. And we're going to see on the next slide that when we're looking at the muscles in between the ribs that are close or underneath the costal cartilages, that's going to be a different intercostal muscle. So let's go to that one now. And here we can see the other muscle that I was telling you about. Those are the internal intercostals, and they originate from a lower rib and insert on an upper rib. They originate from a lower rib and insert on an upper rib. And when you look at those fascicles, the striations of that muscle, we say hands to the chest. Orient your hands pointing up to your chin even. And that means that these muscles originate from a lower rib and insert on an upper. When muscles contract, insertion is pulled towards origin. That means these muscles are going to be important for exhaling. And here's where you need to be careful. When these muscles contract, they are helping with exhaling. Normal, quiet exhalation or expiration does not require muscle contraction. So for your internal intercostals, they are going to be helpful for forced expiration. Maybe you've been running and you're trying to catch your breath and you're really exhaling very hard. That's when you're using your internal intercostals. Another time you use them is when you're coughing. And perhaps you've actually used them too much if you've been very sick and coughing a lot. You can actually feel those muscles pulling and getting sore. All right, that concludes our short video for muscles of the chest.